path.
Thank you, Justice Gustafson. As I'm sitting here, I've kind of realized that I've been doing these presentations for the past 2.5 years. I came into my role as division administrator in May of 2018, so I've had lots of opportunity to talk about child welfare in Montana. Over that time period, I feel like I've been able to find a way to not get nervous for presentations, and today I'm finding myself extremely nervous, and I think that that tells me that what's going to happen over the next 2 days is an opportunity to really work together to improve. And so I just want to thank you all for being a part of this. My history is that I've been a social worker in the state of Montana for the past 25 years. I just want to say that child welfare is important. It's hard work. In fact, I can't think of any work that is more important. And as we spend the next few days together talking and learning about what child welfare looks like in Montana, I just want to remind us all that what is reflected in the numbers that we will be speaking about are real children and families. And these children and families live within our communities, and their lives are complicated. Our families face some of life's hardest hurdles. They struggle with addiction, domestic violence, mental health, and often these issues go back generations. And when families come to our attention, oftentimes they're at the lowest point of their lives. These families need and deserve a child welfare system that is strong, resilient, and can and will challenge itself to improve and adapt to their needs and the needs of our communities. When I came into my role as administrator, children in foster care in Montana had peaked right at almost 4,000 children. This is a data point that brings much scrutiny to CFSD. It was obvious we had to challenge ourselves to find strategies to address these numbers, as we all know that we will never have enough foster homes, we'll never have enough attorneys, child welfare staff, judges, or service providers to continue to absorb the growing numbers that we were seeing. Currently, Montana has the 3rd highest removal rate of children in the country per capita. We've been exploring what could be contributing to those numbers, and it again is complicated, and I'm sure it's multi-factored. An interesting fact, though, is that the national average of children being screened in for reports of abuse and neglect is 50 children per 1,000. Montana's children are screened in at a rate of 66.6%, and that is the 9th highest rate in the country. I really do hope that when you have the opportunity to break out into your regional teams, that this will be a topic of conversation. You'll be provided your regional data so you can really look at what is occurring in your areas and have an honest, transparent discussion about the why behind what you're seeing is occurring. I'm happy to say we now currently have right around 3,456 children in foster care. And while this is good news, and we've seen the number of children entering foster care decrease and the number of children exiting care increase, it is important that our focus stays on having the right children in foster care. And our focus has been making sure if we can keep children safely in their homes while mitigating safety concerns, that that is what we need to do. If we are unable to mitigate safety, then it is necessary to place children into foster care. We recognize removing children from families when safety concerns can be mitigated can cause unnecessary trauma. But we also know that leaving children in homes when safety cannot be mitigated has consequences of further trauma as well. This is just as detrimental for children. Therefore, it is imperative we strengthen our understanding of our safety model, and as a system, we use it to guide our decision-making and our shared vision for child welfare in Montana. It's imperative that we get decisions right. If the decision to place children in foster care is necessary, the next step is to recognize when we can return children to their homes safely. Conditions of return should not be based on treatment compliance or completion, but rather on our ability to mitigate the danger that has been identified to children. We have spent a great deal of time talking to our stakeholders, our staff, legislators, service providers about how child welfare is a system. And the responsibility for positive outcomes for children and family does not solely lie with the Child Welfare Agency. We all play a vital role in our system, and we all are responsible for the experience children and families have when involved with our system here in Montana. I've heard it said, and I think Justice Gustafson pointed it out again, that there is a thought that foster care has been a failed experiment. I personally find myself reacting to that statement. Foster care has provided a safe space for children, as Justice Gustafson said. It has also helped save children's lives, and unfortunately, I believe there will always be a need for foster care. But what I do know is this: we can improve child welfare here in Montana. I believe that. We can do this work with a focused approach to make sure removals only occur after we have exhausted our resources to keep children safe within their homes. Children should not linger in our system. And not only are the parents' rights needing to be acknowledged, but so are the children's. As we move into looking at some of Montana's data, I want to make sure you know I firmly believe Montana has a strong foundation to continue to build on. One of the first things Nikki and I did, Nikki Grossberg is our Deputy Division Administrator, and she started her role at the same time that I did. One of the first things that we did together is we attended a Casey training for new child welfare leaders. In that meeting, we were asked to state one word that described how we felt about our new roles. My word was hopeful. But I do have to admit, through the last couple of years, there have been times that it has been challenging to keep that word at the forefront of our work. But this meeting with all of you, knowing how busy you are, and yet you're still willing to take the time to be a part of moving child welfare forward, keeps us hopeful. I know and I recognize, and I have to be reminded of this very frequently, that moving this dial of child welfare is going to be slow. But I am confident that together we can succeed and that we can improve our system for our children and families. Now I'd like to pull up our data points. There's just a few basic data points that I want to review with you all. And I really do hope that these points will help guide your discussions when you break into your regional groups. So the first slide that Kelly has pulled up is our kids in care numbers. And this just really demonstrates what I've already talked about, that in 2018, these are for fiscal years, our kids in care numbers topped out at right around 3,900. In 19, we did see that number drop to 3,884, and then in 2020, we were at 3,456. And as I previously stated, really this, it's easy to get caught up in this number, and the focus really does need to continue to be on the right kids in care. If we could go to the next slide, removal rates. Let me see here, removal rates, sorry, I have my out of order. So removal rates and the removal number. So you can see in 2018, Montana removed 2,371 children, and that percentage was at 10.5. In 2019, 2,399 children entered into foster care, our child welfare system, for a rate of 10.6. And in 2020, 2,000 children entered at a rate of 8.9. To put this slide into perspective, the national average of removal is 4%. So while we've had a significant improvement in that removal rate or reduction in that removal rate, we are still well above the national average. If you want to turn to the next slide, please, you will see that our removal rates per region. This slide demonstrates removal rates per region for the 3 fiscal years that I've already spoken about, and they also compare to our statewide removal rate. And as you can see that varies throughout the state. That being said, I just want to say that we recognize that situations, demographics in every community look different. And all of that can impact removal rates and total number of kids in care. Different communities have had different experiences. There's lots of factors that can affect this rate. But I do hope that you take time as a group to talk about what this looks like within your region and really ask the question of why, what's happening, what can we do as a community? If this is something that we're comfortable with, or if this is something that we need to develop strategies around to address. So, thank you.
Marty, I hate to interrupt you, but I'm looking at the regions. Can you tell us the majors, you know, which cities are in what regions, just so we all have a better idea of
Sure.
Where we're looking at, or if you know?
Yes, I do. So region 1 is the eastern region, Glendive, Miles City. I don't want to leave anyone out, but that's the eastern region. Region 2 is Great Falls, the north central region of the state. So Great Falls, Havre, Conrad. Region 3 is Yellowstone County and Lewistown office. Region 4 is Helena, Bozeman, Butte, that hub of offices. And region 5 is the western region of Missoula, Hamilton, Lake County, and then region 6 is the Kalispell area. So next slide, please. So permanency outcomes, just as important as removal rate, right? Like, how do we do once children enter into our system, and what does that look like? I do want to say that Montana does very, very well with placement of kin. We place children in care with a known placement 52% of the time. And that rate can really be up to high as 65 to 70% in some areas of our state. And that's a fact that we're very, very proud of. We lead, you know, we're one of the top states in the country leading with kinship placement. And as Justice Gustafson pointed out, there's trauma when kids are placed. Well, trauma can be amplified if children are placed with unknown providers. So we do feel like our kin placement rate does help address that trauma for children. Another area I'd like to point out is that only 4% of children that enter foster care in Montana age out of our foster care system. And I know 4% is still 4%, and there's children behind that number, and we need to do better, but it is an area that I am proud of, that's not higher. So if you can see that we typically reunify right around 65% of.
Is that with parents, or is that in family of origin?
Reunification?
Yeah.
It is with a parent. So
I just wanted to make sure.
Yep, with a parent. As you can see, in 2020, we had 19% of our cases reach permanency through adoption, and then 9.5 reach permanency through a guardianship, which is the highest number that we've seen for the last 3 years. So just a little bit of information there on how kids reach permanency in Montana. Next slide, please. Length of time. This is something that I think we need to really look at and talk about the why, because as a system, we all play a role in this. What is the cause of our length of time? As you can see, our reunification is right around 335, 325, and 372 days it takes us to reunify. Our adoptions are taking over 1,000 days. So that means a child is waiting in foster care for over 1,000 days to reach permanency through adoption. And guardianship is right around, that 750, close to 800 days as well. Really, we want to see our length of time to achieve permanency to be around 24 months. And I'm no math magician, but I do know that 1,000 days is well over that 24 month timeline. So really hoping that we spend time talking about that. How can we improve that? Some of the internal strategies that we're using, I've already touched on this, but how are we engaging families early on in the process? I do believe that the better we do up front, the better we will see at the back end of cases. And that's really why we're excited about our pilot programs that we have going, trying to engage families very early on in their case, in their process, and hoping that we can see better outcomes in the end as well. I really do believe, I mentioned this in my talking points about how we need to, I believe that parents have rights through our system, but so do kids. And I really do believe that 1,000 days in foster care is not good for children. So how can we do better? And then lastly, well, one more, I guess, reentry rate. Next slide. This slide talks about once children exit our system, what is our percentage of them coming back into our system. So children exit our system and come back in within 12 months. You can see that we're trending in the wrong direction in this. In 18, we had 13.5%, 19, 12.38, and then in 20, 13.71. Something that I personally have noticed and have questions about is, what does our trial home visit period look like? I think typically we've came to a point where we're not looking at conditions for return and returning children when we can mitigate safety, that sometimes we have the tendency to wait until treatment plans are completed, and it's more of a compliance issue versus mitigating safety. And then we place children home, and then we close cases. And really what should be occurring is we should be reunifying children with families when we can mitigate safety, giving families the opportunity to practice the skills that we've helped them obtain, and monitor and support them through that trial home visit phase. And I don't know this, but I'm watching to see if our lack of planning for trial home visits has affected this outcome. So again, that might be a very good talking point to have within your teams. And then lastly, the last slide that we have is our entry and exit numbers. And again, it just demonstrates our entries have decreased and our exits have increased. We have put some emphasis internally on how can we get the adoptions finalized sooner, once that has been the goal. And I think that has improved our exit rate. And we've already talked about our entry and why we think that that's starting to slow. I guess I just want to say that I really believe that data tells us a story, and it's a very important piece of the puzzle. And I'm just encouraging you all to have honest, open, transparent conversations about what this data tells us, and really working together to develop strategies to improve the data, because ultimately that improves children and families' lives. So thank you.